The National Council for Behavioral Health has produced this series of short educational videos for the New York State DSRIP program to assist PPS network providers with implementing best practices for integrated care. The following instructional video demonstrates actions you can take to implement an effective warm handoff within an integrated care setting. In the following scene, the patient, Shannon, meets with her primary care provider to discuss her symptoms.
Well, I've just been having a lot of trouble sleeping lately. I'm feeling really anxious. I have friends who have tried Ambien and it seems to have worked for them. So I just wanted to come in and talk to you today about getting help maybe with my sleep.
Okay, well before we talk about medicine, I think we should talk about your general stress and see if there's something else that could be causing the problem. Has anything changed recently, maybe your diet or your work environment?
Work is always pretty stressful. I can't really think of any big changes that happened recently.
So our clinic is actually an integrated health clinic and we believe in treating a patient holistically. And I work pretty closely with a behavioral health care provider and he has some really great information that he can give you to help talk about ways that you can manage and cope with your stress.
Okay.
So I think he's actually in the office today. I'm just going to step out for a minute, see if he has some time to talk to us.
Okay.
It's important during a warm handoff for the primary care and behavioral health providers to check in with each other to go over the patient's electronic health records in order to review his or her medical history, any medications, and important next steps and follow-up appointments. Working together to address a patient's needs is an essential part of integrated healthcare.
Hi Shannon, my name is Nick. I'm one of the behavioral health providers here. I just talked with Dr. Powers and she let me know you kind of came in and struggling with some kind of stress and anxiety and also some sleep problems. Do I have that?
Yeah, I'm having a lot of trouble sleeping lately and I feel anxious. But I have friends who have seemed to have some success with trying Ambien, so I just wanted to come in and see what my options were about getting help.
Yeah, and Dr. Powers, she'll make the decisions about the medications, but we can maybe work on some things to help you address those areas without the medication.
Yep.
Okay, great. So, what time do you try and go to bed at night? Kind of what?
Usually 11:30.
Okay.
When I can't sleep, I usually find myself on the internet or watching TV or on the phone. Usually, just trying to find ways to keep myself entertained.
A lot of times that gets in the way of our sleep because those screens and that lighting is so stimulating. One of the things that can be really helpful is if you kind of start to slow those things down or even dim them down, kind of creating your own sunset in your house. Or maybe an hour before you are ready to kind of go to bed that you shut your TV off, maybe even lighting some candles, kind of creating an atmosphere for yourself. Do you think that's a realistic thing maybe to try?
Yeah, I could try it.
Okay. A great thing to do is to focus your thoughts on your breath. And you could focus your thoughts on your in-breath, kind of like this. And then focus on breathing out. And what focusing on your breath does is it takes your mind out of worrying about the future, worrying about the past, and it focuses you right here, right now. And that just naturally has a relaxing effect on us. So I think there's some good things to work on. I'll let Dr. Powell know what we're working on. And would you be willing to come back in, say, 2 weeks to meet with me, just to kind of check in and see how the plan's going, and we can adjust it any way we need to? And then I'll let Dr. Powers know what we're working on to kind of close the loop and bring everything together.
Yeah, sure.
All right, great. So let's go ahead. I'll walk you up to the front desk and we can schedule our appointment.
Okay, great.
Awesome.
Thank you.
Okay.
Thank you for watching this DSRIP educational video on a warm handoff for anxiety. The flow of a warm handoff will change depending on the providers involved, situation, and patient. We presented one example of what a warm handoff between a primary care provider and a behavioral health provider could look like in an integrated care setting. As a review, the providers incorporated the following stages during the warm handoff process. Define integrated healthcare. Explain how primary care and behavioral health work together. Ask permission. Ask your patient if he or she is open to talking with a behavioral health provider. Team communication. Primary care and behavioral health providers should consult together on their shared patients. Build rapport. Forge a non-judgmental connection with your patient. Raise the subject. Explain your role, introduce the process, and ask for permission to have a discussion about behavioral health challenges. Reflect on change. Summarize what was discussed. Establish next steps. Assist your patient with scheduling a follow-up appointment. Thank you again for watching. Please refer to the following websites for additional information and resources.